is next on KNEB this morning, brought to you here today by Intralinks. Here's Kevin Mooney.
Thank you, Steve, and good morning, everyone. Paulette Schnell is here, the community health nurse for Regional West Physicians Clinic, and we're going to talk about the Regional West Drive-Through Flu Shot Clinic. It's going to be held on Saturday, September 22nd. That's this Saturday, and they've done it. How long have you guys been doing this flu shot clinic, this drive-through thing? 2 or 3 years at least, right?
Actually, more like 6 years.
Wow.
So
Okay.
got it down pat.
Yeah.
Set up.
Yeah, been doing it a while. And so this is, and it's been very popular. You guys end up giving flu shots to hundreds of people.
Yeah.
On that Saturday.
Anywhere from 600 to 800 people we usually do. So it's very popular and a good way to get that done and not have to stand in line.
All right. So let's get all the particulars as to when it is and where it's going to be at and what people need to bring when they're going to do this.
Well, you're right. It's this Saturday, and it's from 8 till 11, and it's up at Regional West Medical Center campus, and there'll be signs directing you and people directing where to come in at. But we want them to come in on the north side, and we'll have it all set up so we can kind of handle all the traffic and get people through. And then as they go through the line, there'll be some people that will help them with their billing. And this is Medicare only people that we're doing. Because of the way the billing's set up, we can only take and verify those cards outside, in the outside area like that. So they'll come through and we'll get the billing done, and then they come around to the other side of the building as they drive by, and there'll be nurses ready, and they just come right up to the windows and give the people their shots. We ask that people that are wanting the shots sit by windows. We love full cars, so if you have 4 people that can get in the car and come along, we love that. And you can have your Medicare card with you and a short sleeve or a sleeve that can roll up easy so you can stick your hand out or your arm out the window, and we give you the shot and send you on your way.
All right, very good. So it's a pretty simple deal. And then you're also going to have some walk-in flu shot clinics as well, and those are later on in next month, and then even in November, right?
Right. We're going to have a walk-in one for anybody who wants to come get flu shots, October 13th, and that's all insurances, Medicaid, and self-pay. And that is from 8 to 11 at the St. Mary's Plaza. It's a Saturday morning, again, from 8 to 11 on that October 13th. And then we'll be announcing some other ones that will be by appointment later in the October and November. Yeah,
we got some Thursday, October 25th, 3 to 7. Thursday, November 15th, 3 to 7. So there's plenty of time to get your flu shot. And pretty simple thing. Flu shots normally cost, if you don't have health insurance, it's $30.
Right.
So it's not very expensive.
Right, and that price has stayed the same for, this is the 3rd year that the whole idea is to keep it as cheap as we can so people can get in and afford it and get covered.
Okay. What about for children? Do you have to make a special appointment for children to get flu shots?
In October the 13th, no. They can come in with their family, and the whole family can get their flu shots at one time. And the same for those October 25th and November 15th dates. The whole family can make their appointments and come in and get it done at one time. So we just can't do children, of course, with the in the car business, so they have to come in and see us.
Okay. Is there any age limit for children?
They have to be 6 months old to receive the flu shot. That's the minimum age that the flu shot's recommended for.
All right, and then all the way up from there, right?
Yes, everybody from there on.
Okay. All right, I'm going to get mine, so let's do this, and then I think Dave's going to get his, and Rob's even waiting in the wings here to get his flu shot. Now, when people walk in, I had to sign some papers and so forth, right?
Right. There's a little form you fill out, basically your name and address, and you're going to feel a little poke here. I don't want you jumping or crying.
Okay.
Oh, you did pretty good there. No crying.
Well, I mean, I get a shot every day for my MS, so getting a shot for me is not a big deal.
Do you want a Band-Aid?
Sure, I'll have a Band-Aid. I don't care. What kind of Band-Aid are we putting on? We're putting on a Shrek Band-Aid?
A Shrek Band-Aid today.
A Shrek Band-Aid today?
I want Scooby-Doo.
I don't know whether she's got anything but Shrek there, Rob.
We're all Shrek today for the boys.
We're all Shrek.
Rob was thinking of Scooby-Doo Band-Aid. All right, so I'll take the mic here, and we'll let, so we can keep talking. And then we'll let Rob kind of get in the seat here. Let him get his, and then we'll let Dave go ahead and get his. Now, Um,
Left-handed, I rolled up the left sleeve.
oh, you
so I'm
rolled up the
backwards.
left sleeve, so you're backwards a little bit. All right. So, so the benefits of the flu shot, Paulette, as you're kind of doing this, describe why people should get a flu shot.
You know, the flu itself, some people don't think it's a big deal, but it can be, especially if you're older or have any health problems like diabetic, asthma, heart problems. You can end up having a lot of complications. So anybody who has any health problems really needs to consider getting it done because of the complications like pneumonia and some other things that can happen because of that. And then just the person themselves that's perfectly healthy, they get the flu too, and it can knock you out and keep you down in bed for 10 days to 2 weeks. And nobody wants to miss that much work or school. So that's another good reason. Plus, if you bring it home to those little ones that can't be immunized, that are under 6 months, and they get the flu, a lot of them can end up in the hospital just because they're small and their immune system isn't quite mature yet. And so you want to protect those kids too.
Okay, now
Yeah.
pay attention. Don't be talking to Kevin.
All
You
right.
don't want me to miss your
I want
arm?
a bad shot here.
All right, Dave's getting his. Rob had his without any problems at all, and
Good deal.
Dave had his without any problems at all. You want a Band-Aid
You want a
there, bud?
Band-Aid?
Oh, yeah, I better have
Yeah, you better have
better
your
get
band.
shreked up
You
here.
better shreked up
That'd
there.
be nice
There
on
you
that.
go.
Badge of honor.
Yeah.
All right.
You have a matching badge of
Okay.
honor there.
All right. Good deal. All right. We'll talk more about flu shots right after this.
Thank you.
Thanks.
Years of professional service. You can trust Intralinks technical
That's
solutions
live
to
radio.
keep your small
That's live radio there, bud.
Yeah.
up and running. Not having a secure wireless network can put your computers at risk. Call Intralinks at 632-6590 to have one of their highly experienced tech set up,
Yeah, we'll talk
troubleshoot,
about if
and
companies
secure
wanna
your
call you and
wireless
get their
network.
whole
For
staff
weekly tips
Yeah,
and
that'd be
information,
great.
friend
Taken care of.
Intralinks on Facebook at intralinks.net/Facebook.
All right, we're back on News Extra, and we're talking about the drive-through flu shot clinic coming up this Saturday over at Regional West Medical Center, and it's over there at the South Plaza. It's from 8 to 11, and it's pretty easy to do. And once again, this is for Medicare patients only this Saturday. You just bring your Medicare B card there, and you bring it over there, and you show them your card, and they do all the work there as far as that is concerned, and then you go to another little area, you get your flu shot, and you're on your way. And you want as many people as possible. If people want to carpool and put 4 or 5 people in a car, that's good, right?
Right, as long as we can get to that, they can get that arm out the window. So usually like 4 to a car.
Yeah,
That's great.
it'd probably be good. All right, now there was a time, there's been a couple of years here where we had problems with vaccine. I think a couple of years ago we did. We don't have any problems with the vaccine right
Right,
now.
there's no
do we?
shortage. We have plenty of vaccine, and that's nationwide. So nobody's going to be not able to get the flu shot because there isn't enough vaccine. So we encourage everybody that wants one to come get one.
All right. Now up there is our companies that want their employees all want to get flu shots. What do they have to do in order to get an appointment and have you come to the office and get all this taken care of just lickety-split?
Well, we ask that they have at least 7 people. That can be spouses or anybody that they want to bring into the work site where we come. And you can call 630-1650. That's my number. I'm Paulette Schnell, and we'll set up a time. We have a date set up in October where we can come out and just do your flu shots right there at your work site and get you all covered. And like I said, we need a minimum of 7 people, and that's the only real requirement.
That's a great way to get it done, isn't it?
Right, because a lot of people aren't going to leave work to go get it done, or they forget about it. You know, they just get busy. So, and it's a great way for the employer to help protect the people so that they stay healthy and can be at work.
Yeah, so they don't miss work. A lot of times people like, we're going to do it. There's a lot of people here that we're doing that. Dave and Rob and I did it now, but almost everybody else in the building will get it done in October. And we're kind of doing that. You guys will be here and give shots to everybody else. And I have MS, and I don't have any problems with the flu shots. So if you have a disease like I have, do people need to be wary of it at all, or what should they do?
Most times, the doctor is going to recommend anybody that has any kind of diseases like diabetes, asthma, heart problems, MS, to get the flu shot because they don't want the flu on top of that because sometimes the complications can make it worse. Certain times, like if you're allergic to eggs, you should not get the flu shot. And then there's certain times you just want to check with your doctor to make sure because they know you and your medical history. Most, if you have any questions and you do have some medical illnesses or medical chronic diseases, check with them and make sure it's okay. But for those mainstream diseases like diabetes, asthma, heart problems, MS, all those recommend the flu shot.
Yeah. So I've taken one every year, and it's no problem for me. So.
Great.
So, and Dave is still filming here, and Rob walked out of the room here and went back to do some work. He'll be back in talking to Steve about sports. So there really is no reason for people to be wary of flu shots.
Right, and like I said, the main thing is if you're allergic to eggs, then you shouldn't get it. But, or if your physician specifically says that you have a medical condition that you shouldn't. But almost everybody just needs to do that because they want to protect themselves against the flu, even if they do have some of those chronic illnesses.
All right. Once again, 8 to 11 on Saturday, and they pull up just to Regional West Medical Plaza South. And what do they need to have? Just their Medicare B card, right?
Right, the Medicare Part B card, and be ready to have the clothing so that they can get their sleeve rolled up so we can give the shot in their upper arm.
Okay. All right. Very good.
And just load the car up, bring the neighborhood, and come see us.
All right. Very good. Okay. Thanks, Paulette.
Thank
Appreciate
you.
it.